Good evening, ladies and gentlemen, and welcome to Kirklees Council's Third Sector Voluntary and Community Associations Building webinar. For those of you who don't know me, my name's Joanne Bartholomew, and when I'm not dealing with COVID, I'm Chief Operating Officer for Kirklees Neighbourhood Housing. I'm really pleased to be working alongside some great people doing business continuity at the council during this period, and today we're going to be supporting you and colleagues to understand how to safely reopen your buildings. I'm going to work as chair today and introduce you to each speaker, and I'll do my very best to direct any questions you raise to the panel today. If you wish to raise a question, you can do so by typing that directly into the chat in the YouTube that you're currently watching. If you'd like to put your name and the organisation on your question, that would help us greatly if we need to follow up with you and give you any advice afterwards. I'd like to thank you all for your time this evening. Our community buildings are vitally important to the vibrancy of our places and provide much needed anchor points for our communities during all sorts of times, and they are particularly important during this really difficult time. You support our residents in many different forms. So you're key to the safe recovery of us as a district. It would, however, be really remiss of me to not take this opportunity to recognise that Kirklees has seen a worrying trend in the upwards increase of infection rates. So I'd ask you all to do your civic duty and to remind your family, your friends, those people you work with and volunteer alongside, and those hirers and users of your facility, to keep socially distancing, to maintain good hygiene, and to support everybody appropriately. We want to prep you for opening, but we recognise that over the coming months, that might be quite difficult. At the moment, we all feel like we're moving into a recovery phase, but that might change. So everything you do from this step forward is appropriate planning for you recovering and potentially, if we have to, rowing back from that point. If in the unfortunate incident that I lose connectivity, Emily Parry-Harris will take over chairing for me, and I'd like to thank her for that. So what I'm going to do now is I'm going to introduce you to each of our panel members, and they're going to say a little bit about themselves and a little bit of advice and guidance that we think will be helpful to you. After that point, I'll turn to the questions that you raise and direct them to the panel, and hopefully that should mean that we can all leave here today having upskilled each other and worked together in order to be a stronger community. The first thing I'd like to do is I'd like to hand over to Emily Parry-Harris and Donna Roberts. Emily is a consultant in public health here at Kirklees Council, and Donna is our lead infection prevention and control nurse. Both have been vital to the recovery of our services and the ongoing support that we've done here at the council. They're going to talk, Emily's going to talk first, and she's going to talk through the key aspects, and then Donna's going to take you into some individual aspects of infection prevention and control. So I'd now like to hand over to Emily.
Thank you very much, Joanne. As Joanne says, I'm Emily Parry-Harris. I'm consultant in public health at Kirklees Council. I wanted to take this opportunity just to give some really clear messaging about our response to the ongoing pandemic. That's key to this. We are still in a response phase to the pandemic. We all have our part to play in those messages of social distancing, 2 metres in all spaces where 2 metres is possible. Where social distancing at 2 metres isn't possible, then 1 metre and the use of a face covering is recommended. It would not be a public health webinar if I didn't go on to say that the second most important thing that we have in our toolkit is hand washing. Hand washing with warm water regularly and for at least 20 seconds. 2 verses of Happy Birthday. Try and find something else to sing as well if you are bored to tears of singing Happy Birthday. But that remains incredibly important. Warm water, 20 seconds and frequently. Use of alcohol hand gel with at least 60% alcohol content if soap and water isn't available to you. Then the new guidance that's just started to emerge around the use of a face covering if you are in a social space. Remains incredibly important that if you are coughing and sneezing, that you cover your mouth when that happens, and that you wash your hands immediately afterwards. And then I think the last thing to say is that we need to be really, really consistent with these messages. We need to model this behaviour at all times. I think there's been a period of time where we'd all kind of relaxed a little bit, and that people had started to behave as though the virus had somehow gone away. It hasn't, and we need to be modelling this behaviour. That was all I was going to say. Now I'm happy to contribute more as we go on in response to specific questions. Donna.
Hi, good evening. As you've said already, Emily, that the fact is that COVID-19 virus is still amongst us, and it's certainly not going to go away quickly. And just because sort of restrictions and lockdowns been lifted, it's really important, it's paramount that we all remain vigilant and alert to the signs and symptoms of COVID, in terms of obviously those classic symptoms of a high temperature, a continuous or new cough, and loss of or change in the normal sense of smell and taste. So anybody which are obviously displaying those kind of classic symptoms, we are encouraging to remain at home and self-isolate and not mingle within the population and have contact with other people outside their household. I think we've all got a responsibility to protect each other from COVID and that potential harm, which really includes taking sort of reasonable steps to protect people that we're working with from coronavirus, and that includes having a sort of comprehensive risk assessment in place which can help manage risk and protect people essentially. So it's about identifying what work activity or situations we might be in terms of what might cause transmission of the virus. Obviously, we know the virus is spread via respiratory droplets, which can be released when we're talking or coughing, and also by touch by people that might not necessarily have cleaned their hands. So those are the two main forms of the transmission of this virus, and it's been sort of being mindful of that constantly. So as Emily's alluded to, hand hygiene is the key element in this, in terms of breaking that sort of transmission. Washing hands for 20 seconds or more, using hand sanitizer and having that available where hand washing facilities might not be easily accessible. Good respiratory hygiene, so catch it, bin it, kill it, etc. And obviously the government guidance is still maintaining that we should all be maintaining a social distance of 2 meters or over, and avoided sort of crowded areas. We know as from today, sort of there's been new guidance released around facial coverings. We know that that's mandated for people that are travelling to and from work on public transport, and that's now been introduced in terms of people should be expected to wear face coverings in shops and supermarkets. I mean, I acknowledge that on this webinar, I might not be able to answer every single question that people might have, so I encourage people to contact myself or the infection control team if they need additional support with any new situation or scenario that people might face whilst they're looking at reopening, because we are really keen to support everybody the best we can in this new sort of situation, as far as practically possible. So those are some of the sort of key messages in terms of thinking about the areas that we are looking at opening, looking and thinking about sort of the ventilation in those particular areas. We know that evidence suggests that the virus is less likely to be passed on outdoors, but in a well-ventilated building, we can reduce the particular risk to individuals. And I think that's about it, really, unless anybody's got anything specific that they want to ask me.
We've not yet seen any questions come through, Donna, but what I will do is when everybody spoke, I'll bring those questions out. We did have some previous questions. Thanks very much for that, Donna. I would like to say to colleagues that are on this YouTube video or watching it afterwards, I do know that the school sector have found the support and guidance for Donna and Jane at the team at Infection Prevention Control invaluable, about talking through those situations and helping them get some advice and guidance guidance. So I would encourage everybody to take Donna up on that offer, that if you do need some support, it is there for you to access from Infection Prevention and Control. I'd now like to introduce our next speaker, Emma Griff. Emma works at Kirklees Council as a Facilities Management Officer. Emma's going to talk you through some guidance that we're going to send out to you after this call, which I'm certain you'll all find incredibly useful in the coming weeks. Emma, over to yourself.
Thank you, Joanne. So I'm just going to share one slide with everyone, and what I'm just going to do is talk you through some of the key points for the slide. And what that will do then is it'll work through some of the key areas that we want to be looking at. So I'll just load that up. So, like Joanne said, we'll share the main document after the webinar, but it's essential really to understand the council's involvement in each building, and this is going to differ based on what actually our involvement is in your facility. We're going to range from facilities that we've got full ownership of, or we commission services in, where we might be coming and asking for risk assessments or providing additional support, right through to the other side of the range, which will be assets that we've got no physical involvement for, we don't own, we don't manage, etc. But what we will do is be able to provide support and guidance to the committee to help them open the building. One thing that we've always been really clear about, it's essential that all management committees of any community facility don't open their doors until they are really confident that they've covered all the issues in the document, plus any other issues that may particularly prove an issue for their facility, because obviously every facility is different. The real areas of things to consider. So it's listed there on the slide, but I'll just work through them. Risk assessments. It's essential that risk assessments for the building are completed. This needs to be done by the management committee, and it needs to really look at what measures are going to be put in place to ensure the safety of staff, volunteers and users. This really needs to be shared with your hirers. What we've done as well is at the end of the guidance document, we've provided a risk assessment, an example risk assessment, to help you just look at all the areas that you need to be looking at. Hirers also need to complete a risk assessment for their activities. So you need to then share your building risk assessment with hirers, and what they'll include is theirs is more around what their activity will be, but it will include the building information as well. Again, an example is available at the end of the guidance document for you to share with them if needed. A key area is safe areas of access and egress, so it's access to the building and exits. So we really need to give some consideration to the flow of any facility, especially if you've got multiple users in that building. One-way systems are absolutely ideal for that, and they're the simplest way of ensuring it. But again, every facility works differently, and we are absolutely 100% that it may not be possible in some buildings. So alternatives need to be considered, like staggered start and finish times. But it's also really essential that there's clear and concise signage explaining what users should do, and that hirers have been fully informed of all the changes before they actually attend site. Kitchens, toilets, shared spaces, for example, lifts. We're now recommended that these are generally a one in, one out room. Kitchens shouldn't really be a communal space now, and there should be no shared crockery or cutlery. Hirers are really going to be encouraged now to bring their own refreshments and possibly use disposable items like paper cups. Toilets should be considered in the same way, but all facilities need to just bear in mind the HSE guidelines for the number of people and number of toilets needed in each asset. So you will have to consider how those toilets could be used. Booking systems, test and trace. So all hirers should provide contact details when they're booking your facility, but now it's really an essential piece of information to assist that test and trace system. Hirers now should also be ensuring that they're obtaining the contact details of anyone who was attending any of their bookings or events, and again, it's just to assist in that tracing system if there is an outbreak. Cleaning and hygiene, a really big one. I know we've had a lot of questions about that, and it is really essential that a suitable cleaning regime is in place for all facilities, and this can only really be decided based on the facility itself and how often it's used, and it needs to be identified in that building risk assessment. I appreciate there'll be lots of facilities that don't have a contracted cleaner. So management committees will need to look at high-risk taking some of that responsibility for cleaning their areas before and after use. And that can also form part of their hire agreement, so it can be part of the contract that they actually sign up to. We have provided a further list in the guidelines of all cleaning recommendations and things like hand sanitizer and where it may be best to place that. That's all in that guidance note. I think one of the most important ones, and it's kind of the last point of this, is communication and information sharing. We would really recommend that any facility, once they've got through the checklist and the guidance and they feel comfortable that it's time to open, to actually have a user group meeting. And you can either do it virtually like this, or you can do it socially distant in the building. That way, it's bringing the hirers in, bringing them on board to what changes you're having to make and why you're making them, but also just let them see physically what that means for them and what that means for their sessions. And it gives them the opportunity to ask questions or raise concerns, which will then hopefully allow you to iron out all those issues before the asset actually opens. I appreciate I've just gone through a lot of information there. Like we said, we've got the guidance document. We will be sharing that after this. But it's also worth noting, we've also got some additional guidance now from the government today, so we can provide that link to that as well. Thank you very much.
Thank you, Emma. Thanks for sharing that. I have to say I've read the guidance that you've put together for community associations, and I think it's very comprehensive and thorough, and will definitely help guide them through these next few difficult weeks. And obviously, advice and support continues to be there if they need that.
Yeah.
What I'd like to do though now is I'd like to turn to the first of two colleagues who've got some real experience of running this through this particularly difficult time. The first is Jamie Nelson. Jamie works here at Kirklees Council, where he does venue management, and he manages some wonderful venues that are unfortunately shut at the moment, such as Cliff House and other places like that. But Jamie, I understand that we've run the Dram Centre throughout this whole period, and I think there's some real key advice and guidance that you can share with colleagues around some lessons that you've learned during that. So over to you, Jamie.
Absolutely, thanks, Joanne. Yes, so there's a couple of key points that we've kind of learned throughout the journey of kind of responding to COVID in a kind of operational perspective. One thing, as you can see, as you walk around in kind of general public, there's a lot of signage around, kind of indicating where people should and shouldn't go. This doesn't always work. People generally do follow it, but a lot of people don't. So that reinforcement and supervision of those requests and requirements are really important. So as a building user group or building manager, it's really important that you reinforce that with all the users that are coming in the building, as Emma alluded to as well, around those key meetings and discussions with those key users. It'd be really important to reinforce those messages. Another one we mentioned earlier was hand sanitizers. And the issue we've had is, unfortunately, it does go missing. It was it did go missing. So ensuring you have plenty in stock, but also where possible, having it wall mounted is a real key thing, so it doesn't go missing. It's all these controls that Emma's talked about are relatively strange for people when they come back to a building for the first time. So that's why I think it's really important, again, to have those meetings, have those discussions well in advance of people coming back, so they know what to expect. And we talked about the risk assessment. All those documents need to be shared with all those key people, key user groups, so that they can read, understand, and know what to expect when they arrive. It also helps as well because we had a lot of people that were nervous about coming back to the building. So in knowing what to expect when they arrive, and also what controls are in place, they can feel confident and safe whilst they're in the building as well. We are looking at the Dram Centre as well, that we can use CCTV to monitor people's movement around the building. So that's also a key part of that supervision element that we talked about earlier. When you're completing your risk assessments as well, I think it's really important to actually go down to the actual buildings you're in rather than conducting them remotely. Perform those tasks, walk around, test out how people are actually going to access the building. How is it going to work in reality? I think it's really important to do that. And then, as we've found out throughout the process of dealing with COVID, guidance changes a lot, and also your risk assessment needs to change as a result of that. And throughout that process, we've been recording that and then sharing that with all the user groups to ensure that our risk assessment remains up to date, but everybody that's using the building also remains up to date as to what the requirements are. Those are the key kind of learnings that we've had from the DRAM Centre at the moment.
Thanks very much for that, Jeremy. Real valuable information. I do know that hand sanitizer has been a very much a gold basic commodity, and that I would like to reiterate a message that Emily's always telling me, which is that if you can provide hand washing facilities, they are the key. But good to know that actually that we need to continue to reinforce those messages, and that when you held and engaged with users, that sort of provided that reassuring presence. I think sometimes that is the key thing for us with that sort of thing. So thank you very much for that, Jamie. So I'd now like to turn to Lisa Newbold. Lisa works alongside us in one of our partners, that's Local Services to You, which is based out in the Chestnut Centre. She works there as their community services manager, and all throughout this period the Chestnut Centre has been there providing valuable support to key worker and vulnerable families throughout this. So Lisa's got a wealth of knowledge about how you manage through this difficult period, and I'm sure she's some great things to tell you. Over to you, Lisa.
Thank you. No pressure there, thanks. Yeah, reiterate what Jamie said. We have been open right from the beginning. So it's been an ever-changing daily situation, obviously, as more children came in, as more staff returned. So it's important to keep the dialogue open. For us, it's all about relationships. Keeping the dialogue open with the staff, the tenants, the regular users. They've just started to contact us about coming back. So the risk assessment, each time they call, becomes out of date and we have to update it. And just appreciating that people are in different places, both emotionally and professionally. So as you're dealing with one person who's never stopped working and then dealing with somebody else who's had 2 weeks off, someone who's had 6 weeks off, it's yeah, the relationships become all important. And to say, keep a level head, I would say, as well, and use your common sense. You know your buildings, you know the logistics, you know how it worked before, and so you can apply the guidance to that and change it. We've used lots of different exits. We've changed the times all the people arrive, the children arrive, the parents arrived. A top tip I would say would probably be we've bought walkie-talkies, so we don't have to walk around the building. We can talk to the staff in all the rooms. I think it was £60 for 6, so it wasn't too expensive either. We also put literally Velcro signs on the toilet doors, the external doors, saying used, not used. And I was thinking we were going to have to hammer holes in the doors and then there'd be a big mess afterwards to sort of new doors. And that's worked an absolute treat. It's funny how in all this, something so small can make such a difference and just make you feel comfortable and relieved that you've sorted one of the important places, except no one ever turns it back to unoccupied. So you stand outside waiting for ages, thinking it's occupied. So yeah, I just reiterate, it is an ever-changing situation and everything sort of takes twice as long as it did before. So if you think something's going to take half an hour, book an hour in because you come across problems and issues all the time. But there's usually, as long as you work together, there's a solution, I would say.
Yeah, thank you so much for that, Lisa. It is so comforting to know that the little things make such a difference out there, you know, and certainly velcroing things on, because if the messages change over the next few weeks, because we've seen that government guidance has changed as knowledge about this set of circumstances emerges, you might need to change some of that messaging. So actually using that Velcro is such a handy top tip. I'd also like to just sort of say, buying those walkie-talkies, what an absolute gold point for you. Communication between staff and volunteers working in facilities, particularly when you're doing a one-way distancing situation around your building, must be incredibly difficult. So to be able to get some reassurance and support on that I think is invaluable. So now, colleagues, we've got a few questions that have come in, so I will ask those. Thank you to everybody on YouTube that's popping those questions on. Please do keep asking them. Nothing is too difficult for the panel, but if they can't answer it, we will definitely get back to you. So let's pick up an easy one, and perhaps Lisa, you could help with this one. One of the questions is, where did you get your walkie-talkies from? And I suppose, are you pleased with them as a product at that sort of very cheap price point?
Well, that's what we thought. We thought, well, we'll take the risk, and they're excellent. They go for miles. So we got them off Amazon. So there was a couple for £60, but because we've got so many rooms, we just took the plunge. So yeah, we just got them off Amazon, and they're clear as day. It's just making sure we're all on the right channel, and if we do get a bit of interference, that we all change to a different channel, and everybody knows to change to that channel. Otherwise, you're talking to nobody.
So you put a little protocol in place, made sure that everybody's got them and they know how to use them. And I suppose when you're using them in a small space like that, you know, you're not going 2 miles down the road, probably something like that just does the job, and that's just what you need in these circumstances.
Yeah, and everybody has their own. I would say as well, one thing I didn't mention was checklists. We've got a checklist to check your checklists, just because obviously staff go off sick, or they're on holiday, and to remember to tell all the staff, the new staff who are replacing them, what to do. Just wipe the walkie-talkie between the shifts, wipe the phone. We've bought extra handsets as well, so we can transfer calls, but we do try and use the walkie-talkies where we can. So yeah.
That's really good advice and guidance, because in your context, this is staff we're talking about, but for a lot of people on this call, it will be volunteers that they're on about, who might only volunteer because there might be a hirer that's doing something once a week, or they might be in a couple of times a week. So actually that checklist mentality of sitting it down so everybody goes through it will help not only the setting, but also their hirers and the users feel much more comfortable about that. And I imagine, Emma, that you could use the risk assessment as a mechanism for providing yourself with a checklist.
Absolutely, yes. If you start your risk assessment quite comprehensively, that is definitely your checklist as everything moves through. And like both Lisa and Jamie have said, that then will continually change and you can add to it. I think one of the myths behind a risk assessment has always been that it's written and it's put in a folder on a shelf. Well, actually, it needs to be a really live document, and that'd be ideal for groups to use then to keep adding. I'm sure they'll find many, many things on every different facility and the different groups that are coming in to use it as well. So it's a definite checklist for that, absolutely.
Great stuff. Thank you for that. Jamie, I've got a question for yourself now. Paul from Huddersfield Mission would like to know what we've used the Dram Centre for. I suppose he's wanting to know what type of use we've had and how easy we've found to fit that use into the building.
No problem. Thanks, Paul. There's been 3 kind of core user groups that have been using the DRAM throughout, one of which was respite care for an individual. So 1 individual and 2 carers that were based in his room throughout. In terms of the challenges around that one, the space that he had was plenty for 2 meters. Wasn't an issue there. It was a case of, as we mentioned earlier, speaking to his care group and also speaking to him as an individual, making sure he was aware of the various controls in place. That went well. We've also had a number of training sessions that were unable to be taking place online. So we had groups of up to 15 in a room that was usually could occupy about 60 people. So we marked the floors using tape showing access points, entry points, exit points, but also where individuals were to be seated throughout. That worked really well, and it was very clear for people as to where 2 meters were. And then we've also had some small group meetings as well of up to about 6 people, again in a similar sort of space, floor markings, individual tables, and individual equipment that we've cleaned after use. So those were the 3 core user groups that we've had in.
Thanks for that, Jamie. That marking the floor out with tape is such an easy solution, but it does provide that visual reminder. I know myself, when I've been stood in the queue for the supermarket or the bank, that really does help manage behaviour of people, and certainly will help community associations manage that social distancing aspect. And I'm really pleased that you mentioned the training aspect, because a lot of organisations will now be looking for space to do training in that can't be done in a socially distant manner, such as manual handling, etc. So being aware of that potential need is good. Lisa, I can see you're indicating because you feel you might be able to add something to that, so please come in.
Thank you. Yeah, just even like you're saying about the tape, even just the stickers that say in this room there is X amount of people allowed, because it just, you know, people do forget, like you say, we took the chairs out and some chairs sneaked back in, and but you can just refer to it as a user or to a fellow colleague or a volunteer that it clearly states we've measured it. It only holds 2 people, 4 people, and people listen then. It's not just you saying it.
That's really good information, that, because actually that will again, when you're a voluntary organisation or a community organisation, makes that information really easily accessed to people if the space itself is almost declaring what it's able to fit in, and it means you're not having to go away and look at risk assessments or anything like that. And again, it's helping you support people to manage their own behaviour. So I'm going to go to, up my list of questions to one that came in quite early from Chloe, who works for Proper Job. Chloe asks the question around, will we need to wear face masks inside, or is that just advice? There's been changing information about face masks, hasn't there, Donna? And currently the government has changed the advice to suggest that you wear it inside shops. Have we got any guidance perhaps for community associations for within their facilities?
I think we need to just be really clear on the distinction between a face mask, which we usually associate a surgical face mask with somebody in the healthcare profession, against what's deemed a face covering. So a face covering essentially is something that should be worn over the nose and the mouth. Public Health England have actually issued guidance on how to make a homemade face covering, and that can be made out of t-shirt material, etc. And that can be bought now for up to £2-4, which obviously I mentioned earlier, they should be worn on public transport when attending a hospital setting or visiting as an outpatient. And now obviously we've had more recent guidance on wearing face coverings in a shop or supermarket. Evidence suggests that wearing a face covering doesn't protect you. However, if you are infected, it would prevent you from spreading the infection to others that you might have close contact with. It certainly doesn't remove the fact that we should be social distancing. But if we're in enclosed public spaces where social distance isn't particularly possible, or where you might come into contact with people you don't normally meet with, then wearing a face covering is relevant and can be worn for sort of short periods, both indoors or in a crowded area. But we can offer further guidance on that as part of the FAQs.
Thanks for that, Donna. So I think what we're saying is that it's really wise to do so. It's not mandated, but the community associations should probably take some advice and guidance from infection prevention and control if they're unclear for either their own use or use of other hirers.
Because it's just, it's important that, you know, when people are putting face coverings on, it's not necessarily going to prevent you getting COVID, but it will help protect others. So it's really important that you don't touch that face covering on a frequent basis, and that actually, you know, you clean that and wash it as per manufacturer's instructions.
Okay, we've had an extra question that's related to face coverings, which I'll take at this moment in time, which comes from Jubilee Melody Makers, which is, will we as a council building users be using face coverings after the 24th of July? I think I'll ask Emily to come in at this point. I think we've just received that advice and guidance, so we'll need to give some thought as to how that works for us. Most of our operations have got some really very clear risk assessments associated with them, haven't they, Emily?
Yeah, absolutely. As you say, Joanne, that guidance has only come out very, very recently. I have to say I haven't read it in detail yet. So I'd like to take a little bit of time and just consider that guidance and come back to that question, if that's okay. As you say, we're undertaking individual risk assessments and making decisions based on the spaces that we're using. Is that okay? I'm happy to come with a written follow-up.
Yeah, absolutely, and we can provide a link in the YouTube thing for colleagues to get written follow-up advice following that. Now I've got a question from the Reverend Joyce Jones. Thank you for your question, Joyce, which is one which I expect is sort of exercising a lot of people's brains at the moment, which is around how many people can be in a facility given what might appear at first glance to be conflicting advice around 2 households indoors and 6 people outside. I do know that it's not quite as simple as that, Emma, isn't it? Because actually it's about the actual social distancing and where people sit together. Could you please answer Joyce's question?
Yeah, absolutely. I think it goes back to that risk assessment as well again. So again, the guidance has come out today and it does seem quite conflicting, but it does also clearly state that where premises or locations are COVID-19 secure, they can hold more than 30 people. But by that, that's looking at what activities taking place, what space they're in, again, what they're delivering. It does all depend on that. Just referring back to that guidance, it does also state, so it is not as clear as what we would hope, that users of community facilities should limit their social interactions to 2 households in any location, or potentially up to 6 outdoors. It does sound quite conflicting, but I think it is very much based around that. What are you delivering from that building? What are your capacities? Now you've got to think of that in fire as well as HSE for toilets and etc. So it does all revert back to that risk assessment. And I think having a look at what they are actually delivering as users out of your building as well.
Yeah, we did have some pre-questions that came in that were very similar around, is it 30 because of the space? Is it more because of the first space? So I think what we'll do is we'll write some advice and guidance out and send that out with the frequently asked questions, because as you've indicated, Emma, it's quite complex. It depends what you're doing and whether they can sit socially distant and a whole host of stuff.
Yeah.
So we'll send some further advice and guidance out from that. But I would encourage you, colleagues that are listening into this call, it is about your risk assessment. As Emma and everybody's underlining, you need to do a risk assessment for your venue, but your hirers or the thing that's happening in the venue needs a separate risk assessment. And it's that separate risk assessment that will help you understand whether your venue is suitable under the current guidelines for that particular use. So we've got some more questions. I'm going to probably ask this question to a non-panel member. We do have some colleagues who are waiting in case we had some questions that were outside of the panel members' remit. And we've got a question around PPE option for community buildings. Now we do recognise, don't we, Jane, the difficulties for colleagues in getting hold of PPE and the difficulty, Donna, in us being confident that that PPE is the right sort of PPE for that type of operation. So Jen, I wonder if you can give some advice and support to community organisations on how they might source the right sort of PPE and what advice and guidance we could provide.
Hi there. Yeah, so we could provide some guidance around lessons learned and some of the due diligence that we've been doing as we've been doing our purchases, and how we've worked with other colleagues such as infection control colleagues to make sure that we get it right. The council has done some bulk purchasing of PPE items, so we know that some of those, there are tensions in the supply chain for particular items at particular stages. So more recently, there's been some pressure around gloves. There is always a big need for the sanitising gel. So we could do some FAQs and some separate guidance, which we could send out after today, if that's helpful.
I'm certain it will be, Jane. Absolutely, I'm certain it will be. So if we attach that to the FAQ, so that question has come up when we've had these webinars for schools and other colleagues. So I'd like to turn now to a question that's coming from Vicky, and it's probably one for yourself, Emily. And I know myself and you have talked about this on a number of occasions, which is, do we recommend taking people's temperature prior to them entering a building?
No.
Well, I knew the answer was no to that, Emily, but could you just to give a bit of reassurance, expand as to why we don't think it has any benefit at all?
We don't want to put extra barriers in place. We want people to be able to notice the signs and symptoms they have for themselves. We don't want to put another clinical barrier in place. That is current guidance. Somebody's asked a question later on about whether something is set in stone. I think we need to be really flexible and fleet of foot with some of this. So at the moment, our current position is no, we are not recommending that people have their temperatures taken on entering a building, because that is not in line with current guidance. That may be subject to change, but at the moment, no.
Thanks for that, Emily. It also stops community associations spending funds on something that they don't need, and temperature taking equipment that's not currently required is quite expensive. And we are mindful of the costs of running buildings during this COVID period. So we've now got a question from Lucy, which I think I can answer, actually. Look at that. Lucy says, there are various groups hopefully restarting soon in her community venue. Would each group have to provide a risk assessment? That's really easy, Lucy. You need a risk assessment for your building that talks very much like Lisa and Jamie and Emma have talked about, how many people can fit in each room socially distantly, what toilets can be used, what your one-way system looks like if you can fit one in, where your sanitising or your hand washing stations are, etc., and all that. So you do that for your building. If somebody's running a weight loss class from that building or running an activity-based thing, they need to do a risk assessment for that individual activity, because they will know their users and they will understand how their the activity that they're doing impacts on that. And I would, if I was running a venue, I would reasonably expect that they would have done that. So you can share the community information that we're sending you and that risk assessment template with them. I know there's a couple of questions further down on my chat line around risk assessments. And one of them is, can we share the templates? The templates are appended to the information we're sending out, aren't they, Emma?
They are, yeah, Joanne, they're on the end of it. There's one for building related and one for user related. We've also appended a checklist, so a lot like what Lisa had said, just reminding people it's not just necessarily about COVID either, it's about reopening a building. So we talk a little bit about compliance as well, just to give that kind of nudge in that right direction.
Oh, Emma, I'm really pleased you mentioned that, because actually I'd forgotten. For those of you whose buildings will have been shut for quite a while, there's all those things like Legionella flushing, etc., checking that your fire extinguishers are still in date, all that sort of thing, that's probably been sat there under a layer of dust waiting for this particular moment. There was also a question around, are our risk assessments set in stone? We like to think that the risk assessments that we've been doing as a local authority for the operations that we do are sound at this moment in time, but they're not set in stone, because as we've seen today, face coverings has changed and every day there's different emerging guidance, and we tend to reflect on that guidance as an organisation and decide which bits of risk assessments for what aspects of service delivery or buildings need changing. So I would always suggest that you need to have one eye on what's happening externally and look at refreshing your risk assessments. What we will do is we'll ensure that when we think that something's happened in terms of government guidance that is meaningful for you, we'll signpost you to that. And like I said earlier, I do think it's beneficial if we do another one of these webinars in a few weeks' time as things have started to settle down. So I hope that answers your question, Lucy, and I think, Richard, I've answered your question at the same time. there's another question around, will libraries have a budget to assist in shared spaces to enact what they deem to be appropriate? Oh gosh, I'm not certain what the angle is around that question to be able to answer it. But I wonder, Jill, if you could give some sort of thought around this particular question. I wonder if what the writer's asking is, how can we facilitate things that are meaningful to communities in the right spaces?
Yeah, sure, Joanne. I mean, I can't give a detailed answer to that specific question, but that is very much part of the consideration of libraries opening, that they do that safely, and that will include reviewing exactly what activities that they can do and to do those safely, and that will be in conjunction with their community partners when they get to that phase.
Okay, thank you very much for that, Jill. I would also say that one of the things that I think yourselves as community organisations with your venues need to give thought to is when you do have lots of users sharing the same space, transparency of risk assessment between both of those users and sitting down and working out the boundaries around that is incredibly important. One of the things that we've done as we've recovered our services back into physical buildings over the last few weeks is give some considerable thought to whether opening that particular building up for more than one use conflicts with what we're trying to do, particularly when that use has had external visitors or customer access. So I would encourage you to make sure that where hirers are either overlapping or sharing the same space, that they have those conversations. Tony's asked a question around, when will the customer service centres be open again? I think the answer to that is when we feel that it's safe to do so, and when we've moved forward with understanding how we deliver those particular aspects of services. We're taking quite a cautious approach to understanding how we open things up. You'll be aware that at the beginning of this, I said that we all need to be vigilant and maintain social distancing, and we feel comfortable that the measured way in which we're opening up our services protects our communities and our staff. We are all as well acutely aware that there are some people who are struggling to access services, and the COVID helpline, I believe, remains open, doesn't it, Jill, for anybody who's struggling, be that with an IT need or anything, to get that support from. I'm right, aren't I, Jill?
Yes, Joanne, absolutely. That is going to remain open for the foreseeable.
Great stuff. Thank you very much for that. So the next question is from Helena from Cleckheaton University, U3A, University of the Third Age. So she's read the guidance, and they don't feel that they'll be able to start in October. So how will Kirklees communicate with Cleckheaton U3A on what can happen? Okay, so I think there are a couple of things there in your question, Helena. And what I'll do is I'll perhaps turn to Emma to first of all, to sort of outline the advice and guidance and support we can give you to understand why you feel you might not be able to open. So you've read the guidance, and what do you think are the things that are stopping you from opening? So how can we support Helena with that, Emma?
I think we would definitely meet with the group. We'd meet with probably David Roach, who is the Town Hall's manager. I do know they have regular building user group meetings anyway. And we would just work through that with them if they really wanted us to do that, just to see where these barriers may be and if there's anything that we can do to assist with that. I think the main issue would be, can we change something very simple to bring them in, and they may not just be able to deliver as they've delivered before. So yeah, we'd absolutely work with our colleagues in the town halls, in venues, and work with the groups that are using our buildings. That's not an issue.
And while you're talking there, Emma, I'm noticing both Lisa and Jamie nodding when you're going, it might be something simple that we can do that changes that. So I'm guessing, Jamie, there were some real big barriers that little simple things made a big difference to.
Absolutely. It is those small things that can make a huge difference. And I think specific with U3A, they deliver a multiple or a breadth of different activity in the building, during their sessions. So it may well be that there's parts of those sessions that can actually still be delivered rather than just cancelling everything. They may well just be able to take parts of it that we can still run. So, but it's worth having that conversation with the number of different departments to help out.
Yeah, and I know it's a very kind offer from Lisa to share the risk assessments that they've done associated with Chestnut Centre, which might help you with that, Helena. The second part of your question was, how will we communicate? How will we help you communicate? If there is a set of circumstances where you feel you've some different messaging, I think, again, we can offer some advice and guidance and support around that, can't we, Jill? Yeah, Jill's nodding.
Yes.
Okay, so let me just scroll down the questions.
Jo, sorry to jump in, but I think there's something about those organisations. You know, the University of the Third Age have commented that they have 600 members. You are going to be really, really important as part of our conduit for getting messages out as well. So we need to use you as part of our communication channels. So if people could make sure that we've got contact details for you, and if you were happy to send information out on our behalf, this is all about using the different channels available to us to get information out into our populations.
Yep, absolutely. We do need to use you as a conduit to our communities, and certainly with the 600 members for U3A and 32 classes. Let's approach that problem as you see it, you colleagues from the University of the Third Age, with a how can we make this work? Yeah, we recognise how important getting back to some aspect of social contact for some people is, particularly the dynamic that the U3A will be supporting. So let's approach this jointly on how can we make this work. It might not be in the way that it happened previously, and it might not be in the place that it happened previously, but if we start the problem from that end, I'm sure we'll be able to get to something together. So I'm going to move on now to some questions that were asked before we went live on the web chat, whilst I wait to see if any more are coming in. So Wooldale Community Centre asked a question, which is who's responsible for the cleaning after a booking? And we have had a number of questions around cleaning, Emma, and I do, but before I turn to you, Emma, around whose responsibility it is, I wondered, Donna, if you could give us a bit of advice and guidance on the importance of cleaning in terms of infection prevention and control.
Absolutely, it's a really important measure because, as I mentioned earlier, about the COVID being transmittable by hands. So it's additionally important that we look at cleaning areas such as bathrooms, toilets, but the high touch areas as well, such as door handles, railings, etc. And I'm just going to read the new guidance after this to follow on to give advice about the products that we should be using, but certainly we should be using disposable cleaning cloths, disposable mops, etc. As part of that cleaning process, but make sure that we're actually using the right kind of products to be effective in those areas.
Thanks for that, Donna. Emma, have we got any advice around how do we support community associations with hirers and responsibilities?
I think that goes back to just very briefly what I touched, and we have definitely put it in the guidance as well, that's definitely part of the discussions that is going to have to be taking place with the hirers. I can't remember if it was Lisa or Jamie that said more time will have to be booked in around those bookings to ensure that whoever does clean areas, but I definitely think it'll have to be a shared responsibility. So committees will have to look at whether they've got the capability or the capacity or the volunteers to be cleaning between groups, and if they haven't, the hirers need to be very much aware that they need to take some responsibility for that. We can absolutely share advice, and again I've put something in the guidance around hand sanitizer units, cleaning materials around the building, but as Donna said, hand washing is key as well. So it's just reminding people that is obviously one of the key defences as well. So definitely a shared responsibility. I harp on about it a lot, but it goes back to that risk assessment. All depends on how that facility is set up, how that committee is set up. Is it volunteers? Do they have contracted staff, etc.? So again, I'm happy to work through that with anybody that needs that kind of process working through.
Thank you, Emma, for that. Appreciated. I would just like to say one of the things that we've put as a personal responsibility for staff when they come into any office or shared space is that you should clean your space before you start, and that you should clean your space when you've finished, and that you should never assume that it's clean when you get there. And I think that's a wise bit of advice for anybody using any facility. So we've another question that's come from Huddersfield Mission that came earlier, which is around the providing contacts around test and trace. So who's responsible for that? And I do know, Emma, that this is in the advice and guidance that you've sent out, isn't it? Around you as a venue should know who's hired, and the hirer should know who they've got in the room. And that's where that responsibility sits, isn't it?
Yeah, basically that. Yeah, we've given a little bit of guidance on how long to hold that information for as well. But yeah, it's as simple as that. The hirer needs to provide that information to the committee, and their users need to provide that information to the hirer.
Okay. Lisa, have you particularly found this to be quite onerous or difficult in terms of yourself as an association? You're struggling to unmute yourself, Lisa. There you go.
Keep you waiting. We haven't, our users are starting to we've had tenants back in, so that was good because we could sort that, and that's sorted. We've just got the group starting to come back in now. So yeah, everything's quite onerous, but you just have to stick with it and you'll get there.
Thank you for that, Lisa. So it's just keeping reflecting back and going through things. So another question around risk registers, which is, are public health able to check risk registers to ensure everything's been covered? Emily, I think probably the advice and guidance that Emma sends out, if that has been completed, is probably would ensure that everything has been covered. Would you agree?
Yeah, I would. I would hesitate to offer that Donna and her already very, very busy and overstretched team would be in a position to check each and every risk assessment. But we can be very confident that if organisations are following the advice and guidance that Emma and her team have issued, then that will be of a good quality and robust.
Yeah, and obviously there has been that offer from Donna for some advice and guidance going forward. Just to sort of reassure colleagues, that's the position that we're articulating now is the position that we've taken with schools, with giving them advice and guidance and structures in which to do that. And as you'll be aware, a large proportion of the schools have opened successfully and continued to run in difficult circumstances over the last few months. We've now got a tricky question, and I have no idea who to direct this one, and it's from Sue Cook from Slathwaite Town Hall, which is, our orchestras allowed to rehearse if each person is 2 meters apart? The new guidance that came out today was quite had some technical advice about noise and various things such as live music. And I think we'd have to go away and read that. I'm sort of, Jamie's nodding. It does talk about live music being something that's not available, and I'm not certain whether rehearsal, I would imagine rehearsal is considered to be live music.
In my very, very brief reading of the guidance earlier, Joanne, it says that singing and wind and brass playing should be limited to professional contexts only. Okay. But it is mentioned in the guidance specifically, but I'd need to go back and read it in some more detail.
Certainly, there's some evidence that suggests that shouting and singing increase that amount of respiratory droplets, and therefore certainly audiences should be avoided and 2 meters sort of social distancing maintained.
Yeah. What we'll do is we'll go away and we'll reflect on the difference between a rehearsal without an audience and a live performance, and see if we can come back to you, Sue, with some firmer guidance around that one. We now have a question from Carol, which is, would Kirklees Council operate within a building which had not adopted a COVID risk assessment? We've an expectation that you will do COVID-based risk assessments for your buildings. If we were operating within your building, we would undertake a risk assessment for that operation ourselves, and we would, and that's our responsibility, because we would, in that instance, technically be a hirer, wouldn't we, Emma?
We would, yes. So we'd take the role of the hirer and we'd undertake the risk assessment. And equally, that's where we would ask for the building's risk assessment to work with as well. So we'd just work in the opposite way then.
Thank you for that. I'm just scrolling through to get to some final questions. So I've got a question from Lucy Powell, which is, and the problem Lucy's articulating that a lot of groups are mutual aid and the test and trace information would go against the principles of anonymity these groups provide. How could we work with that? That's quite a difficult question, isn't it, Jill? And that's around people coming for support, and how do we get enough information around that to support the potential for COVID infection and informing those people? I wonder if you've any thoughts on that, Jill or Emily?
My first thought is there's something about the primacy of actually saving lives and that principle first and foremost. But I think it's something that we can follow on with some of the mutual aid group admin meetings and our partners in the third sector to explore that, because it is something where we want to make that work, not make sure that we're just following unnecessary bureaucracy, but making sure that we are saving life, that principle of life saving comes first, and get that balance absolutely right. So we can pick that up with our partners.
Mm-hmm. Yeah, absolutely. I think there's probably something around us perhaps helping partners that are in that context develop a bit of a protocol around how they would treat that. For that. So we've then got a question that has come in from Councillor Smage, which is, how do we ensure air circulation? Do we need to use only rooms where windows can be opened? We've had many a conversation, Donna, haven't we, about ventilation and its importance and also air circulation. I wonder if you could comment on Councillor Smage's question.
Yeah, I mean, as most people will know, evidence sort of suggests that the virus is sort of less likely to be passed on outdoors and in really well ventilated buildings. So, I mean, the recommendations really would be that in good weather to try and leave windows and doors open in areas where we might have a lot of congregation or people coming together. If possible, have outdoor activities. So maybe when we go look at the orchestra comments earlier, that could be conducted outside. We can use external extractor fans or internal extractor fans to keep spaces well ventilated in addition, but they shouldn't really necessarily be pointed at doors so that we're not drawing air in from corridors. But heating and cooling systems can be used as normal at the normal temperature settings.
Lisa, do come in if you feel you've something to add.
I've got a question, sorry.
Oh.
So if you were risk assessing it, and Emma as well, and you did have a room that had no windows, would you say you can't use that? Or would you, if it was a room, say, that you'd worked out could hold 4 people or 6 people, would you just maybe reduce the amount again and then suggest face coverings? Because that's what I would maybe assess.
That's the solution. If people are happy to wear the face coverings and where we don't necessarily have a window to open, then that seems a practical solution.
Yeah, no, I'd agree as well. Yeah, reduce the numbers. It's not a no on the room, but it may not be the room that's used the most, obviously.
Yeah.
Okay, and we've got an easy question, which is, can refreshments be served if they come from disposable cups? And the answer is, we should think they should always come from disposable cups, don't we, Emma?
We do, yes, definitely.
And then I've got another question under that, which I can't quite work out what that one's doing. So Patrick, if you could just have a look at that question, the second one up for me, while I turn to another question from Sue at Slathwaite Town Hall. Can we host training courses in meeting spaces? And if so, is there a maximum legal limit on the numbers attending if space permits? Jamie, you've done some training courses, and I think it's as simple as the space permits the number that it permits, isn't it?
Yeah, exactly that, Joanne. So all we did was measure out the space that we had, look at the key bits where you couldn't just put your grid out on the floor to maximise the space, because you've also got considerations about fire exits, entry and exit points, to make sure you've got that flow around the room as well. So don't just look at it basically in terms of the square meterage. Actually go to the venue, which I mentioned earlier, go see how it would work logistically about moving around that building. And just picking up on the point as well around refreshments, we had that question raised in relation to some of the training that we had, and we decided against it purely because hot drinks, for example, if we're using a hot water boiler, it just meant there was a lot of touch points going on that water boiler. So we just recommend that people bring their own at the moment. That was just purely practical thing for us at the DRAM.
Okay, so actually it's disposable in any event, but actually your kitchen facility might create such a pinch point that actually you don't believe that it's something that you can safely facilitate. So there are those two aspects to understand from that. And then Jubilee from Melody Makers have asked, could you meet and sign outside? Yes, absolutely, people can do that. And then there's a question which is, where do we get the signage for buildings about maintaining distance from? Lisa and Jamie, did you download yours from the internet? Did you create it? What did you do? I'll turn to Lisa first.
We decided to buy them because we wanted stickers so they couldn't be removed. Because we thought about the posters of the blue tack, but the stickers can't be removed. We've also bought a couple of just cheap sandwich boards, just so that you can change. Because you know what it's like when you go in a building and the same signs are there, everybody stops reading them and they just become part of the furniture. So then we can update the sandwich boards, put a star on it or a red something to bring people's attention to it, maybe put it outside particular area that's going to be used on a weekend or something with the information, so you can constantly update it.
Jamie, did you do anything different? Oh, sorry, Lisa, had you not finished? I do apologise.
Sorry.
Jamie, did you do anything different?
It was a bit of a blend between the two. We did our own, but we also used a lot of the generic things around the NHS guidance around washing hands and things like that were placed in the kind of public toilets and things. So it was a blend of both.
Right, great stuff. Thank you very much for that. So over the course of this conversation, we've talked about the advice and guidance, and that we're going to send that out to people. Are we got? My understanding is we're going to append it to the link of this YouTube video, aren't we? So this YouTube will be available, and that advice and guidance will appear in the comments as a link for that. And we'll ensure that. Somebody's just corrected me on the chat. Apparently I misinterpreted the Melody Makers question. It wasn't that you wanted to meet and sign outside, it was that you wanted to meet and sing. That's what happens when you're reading the questions on the chat a little bit fast. I think the advice and guidance for open air concerts is slightly more relaxed at the moment, and that actually that sort of thing can be done in a socially distant manner outside. But what we will do, because obviously if that's an important aspect for our communities, is we'll give you some further advice and guidance on that, Melody Makers. Okay, so I think I've come to the end of the questions. I'm just going to turn to Jill Greenfield, who those of you that work in the community sector will know and recognise from all the work that she's been doing throughout this COVID period, just to do some closing statements before I just wrap us up. So over to yourself, Jill.
Thank you. I just want to say what a great lot of questions that's been posed this evening, and it's brilliant just to see everybody's commitment still to opening and providing that, you know, real anchor organisation in our communities that really does provide such valuable support for all our residents, and also the creativity as well in doing that. I've really enjoyed listening to the simple tips and tricks that have been offered tonight. I hope everybody's been able to learn from those, and I look forward to the time when we can really see more and more of our community buildings open safely, and also when we do need to be able to close them quickly and safely and supporting our residents at the same time. I think I also just wanted to make an extra plea, which I know has been made throughout this webinar, that whenever anybody has an interaction when they have the opportunity to carry a public health message, please do take that. It is really important that we keep plugging away at those messages. And just a couple of plugs from myself on the plug theme, just to remind people about the Places of Worship webinar on Thursday. We're holding a second webinar to support our faith communities to respond and ask questions about the updated government guidance with regards to places of worship. The webinar is taking place on the 16th of July at 6 p.m. Again, we can attach that link to these messages, the information that goes out from the from this webinar. And just for clarity's sake, that the funding for hate crime webinar with the Home Office, which was previously scheduled for that time, will be filmed and disseminated to all of our networks by Monday the 20th. And again, there'll be opportunity to ask questions which will all be answered via the community service. That's it from me. Thanks, Joanne.
Thank you, Jill. There's just one question come in, and I obviously will do the courtesy of answering that, which is coming from Simon Ashby. Simon raises a really good point that there has been increased costs for running these community buildings, and obviously that the guidance is fine and appreciated, but the costs of fulfilling that is critical. I would encourage an open dialogue with the third sector leaders group and with us as a council and your partners around the pressures that you're facing as community organisations over the coming weeks. This is the first of a number of webinars that we'll do with you to support on that. And so if you can feed back to us any of those particular pressures you're seeing in your communities with your venues, then we'll work with you to understand what we can do around that. It just remains for me to thank colleagues. Behind the background, there's been a number of colleagues, Olivia and Patrick, who've been moving questions around, and I thank you for that. Thank you, Kate, for all your preparation. Thank you to Emma, Donna, Jamie, Jill, Lisa, Emily and Jane for answering questions here today. And I hope you all take care, stay safe, and remember, always be kind to each other. Thank you very much for your time.